Well, thank you guys for joining us, whoever's able to hop on this afternoon. We are very fortunate to have Dr. Cleavon Gilman chatting with Doctors in Politics today about his experience in Yuma, Arizona, where he was, I guess, asked not to be so vocal about his statements regarding what has been happening there on the ground with COVID. So, Cleavon, could you give us just a couple of minutes of background on what it is that happened to you there?
Yeah, so what happened is the weeks leading up. Just kind of as a background, this is my third surge of the pandemic I've been on. I've been in New York and in Arizona here in June, and then again in October and November, again getting really bad here again. And so the week prior to November 22nd or 23rd, we were getting a large amount of COVID cases, and Doug Ducey, the governor here in Arizona, was telling everyone there were 150 beds, 180 beds. But I got to my shift, and I had 3 ICU patients I couldn't transfer out to any hospitals. And and so I went to Twitter. I put a tweet out there about no ICU beds, and it just went viral. Next morning, I saw that it had like 80,000 likes or such. And so I kind of explained it a bit more, and then I was told that I could not return back to work. And my medical group and the hospital were negotiating for 3 weeks, and without them letting me return back to work. And so a reporter had reached out to me that night. She heard about it somehow, and then I told her what happened, and then it went viral, and then I went back to work on Monday.
Oh, wow. So that was as a function of advocacy that people had done on your behalf and that you had done on your own behalf, I guess, that you were able to go back.
Yeah, so I've been advocating for teachers, healthcare workers, about this virus ever since March. And so people know that I'm very authentic. I'm a real person. I'm out here putting in the work in the ER, and I'm coming home telling you about the things I'm seeing on the fronts. So when that happened, people had my back, and like honestly, I really appreciate that. That was, it's a scary thing to be an advocate. It's a very risky job, but I don't feel like I did anything wrong, to be honest.
What do you think about the role that physicians have, who are frontline workers, in bringing visibility to some of these issues, right? I think a lot of Americans don't necessarily appreciate what is happening on the ground. Do you think we have a responsibility to be educating people about what is happening? Do you think it helps for people to kind of take the right action in their own lives to prevent the further spread of this disease when we are more visible?
Yeah, I think so. So look, if people don't want to hear from hospital admin, they don't want to hear from politicians. They want to hear from the people on the front lines who are treating the patients who have the virus. These politicians out here, they're talking about, oh, it's like the flu, oh, it's a hoax. Well, they're not treating patients, right? They're not intubating teenagers and 20-year-olds. They're not sitting across from loved ones in a consultation room and telling them that their family members just died from the virus again and again and again every day for the following weeks, because these politicians fail to implement any policy to actually stop the production of new patients. And that's the thing, right? We have a moral obligation as a physician, as healthcare workers, to tell people about this deadly virus. And you'll see, like back in March, like I got on my phone and I was like, I put out a video because I had saw this deadly virus then. And I was like, look, guys, it's not a matter of if, but it's a matter of when. And hell yeah, I was right. Of course I'm right. Like, it's a virus. It's going to spread across the whole U.S. and to do nothing and to let it spread is just reckless. And I'm not saying anything that's new or anything that's, it's a virus. Like, we need to take it very seriously. And it's our job as doctors, as physicians, to do that. But doctors can't do that, right? They can't, because there is the admin part of the hospital, right? And then there is the actual people who actually treat patients. And the admin people run it as a business, and they don't want the workers in the hospital to say anything about what's going on, because they fear that it will look negatively upon the hospital. And that's not the case. This isn't about the hospitals. This is like about policy, and it's always been about policy.
Yeah. So I was very fortunate for our audience here that I had, a 30-minute call with Cleavon prior to our Facebook Live, and I got to know a little bit about him. And we talked about, the importance of doctors actually not only being visible in terms of their advocacy, but also stepping up to actually run for public office, because so many politicians don't necessarily understand, the issues that we grapple with that are really super relevant in the lives of all Americans, and not just in healthcare within that space, many different policy realms that actually come to bear on health. So one question I have for you, Cleavon, is do you think that beyond, do we still have Cleavon? Did he hop off? Well, I guess the question that I had.
He's coming back on.
Got it. Okay, thanks. Excellent. Yeah.
What was the question? I got everything until the end. What was the question?
Yeah, the question that I have for you is like, do you, beyond being vocal on this particular issue, right? Like, I think in this pandemic, our voices are particularly relevant. I think it's obvious that we're particularly relevant as physicians who are treating patients who are falling ill and dying from this disease. But do you think that we have a role also in public life? In order to influence policy on housing, on transportation, on immigration, on education, things that I will argue are very interrelated with health.
Right. Yeah. No. I think it's very important for doctors to be running for office, because everything runs around health. If you're not healthy, you can't do other things. So for example, people who live in a community with a lot of gun violence, that's a public health issue, right? They don't feel safe in their community. They're not going to go outside. They're not going to exercise. Also, these places that have food deserts as well too. They're not going to get healthy foods. They're going to get increased coronary artery disease. So doctors have a unique perspective that politicians really don't understand. We treat these patients. We can kind of speak to, like, I have a patient that has new onset diabetes, and I want to prescribe insulin for them. How much is that going to cost them, right? We have people here in Yuma, Arizona, who are paying $800 for meds a month, and they cross the border to get it for cheaper, for like $100, and they can't cross it now because of the pandemic. So these are issues that people are going through, that doctors have a unique perspective for. And the pandemic, of course, is I mean, if we had more doctors in politics, we would have surely had a better outcome than 300,000 killed and 225,000 excess deaths as we have right now.
Yeah, it is unfortunate to me. I think we may have lost him again momentarily. It's unfortunate to me that we actually do have some physicians in Congress, for instance, right? But unfortunately, I think that they have not been advocating in service to the most vulnerable communities, right? And that's why we don't have policies that serve those communities. What I thought was really interesting about your story, Cleavon, is that there are so many intersecting issues that I think that you have faced personally that are so pertinent to I think good policy making. Like, as we discussed before, like the best policy, the most relevant policy is the policy that comes from the people who are closest to the struggle, right? As I had mentioned, that's just my view on this. And I think that you have, like, from what little I've learned about your life experience, there are so many ways in which I think your life experience will inform good policy making. I mean, from your perspective, what are some of those things that you can share with some of our physician audience and others who have joined us today?
Of my upbringing and how that.
Sure. How that's relevant. Yeah.
He's got poor signal.
We lost him for a second. Oh, there we go.
Yeah, so I grew up in Lakewood, New Jersey. I grew up in a single mother household. I didn't know who my father was at the time. He wasn't really in the picture. And then my stepfather was there. And a lot of us in our community, this was during the black tar heroin epidemic that swept through Jersey in the 80s, in the late 80s and the early 90s. And a lot of people got hooked on heroin, and a lot of people got HIV and AIDS afterwards, and they did not have access to medicine to save their lives. My stepfather, he didn't have access to psychiatric care to help with drug abuse. And, he ended up having a heroin overdose when I was in boot camp. He was in his 30s. So, I think now people are talking about the opiate epidemic because it's in richer areas, right? And now it's an epidemic, but it was an epidemic back in the 90s in poor communities, and so was the AIDS epidemic. So I always look at it like, how do we treat our most vulnerable people in society? And we really need to be helping those people and advocating for them. It's a pretty inexcusable. It's crazy. You can hear me?
Yeah, you came back. Yeah, I think that we caught most of what you were saying. Yeah.
One of the other issues is that when I moved to Manhattan, my mother-in-law was trying to get an appointment. It took her 6 months to get a primary care doctor appointment. Because, and she's not the only person who's dealing with that, right? Everyone in the community is are trying to get a primary care appointment in Manhattan.
Yeah, yeah. And I think also the problem is like the people who are making the policy who don't have this like really explicit insight into like how it impacts upon ordinary Americans. Like they're, I think, more susceptible to being like persuaded by special interests where, they may get some personal benefit from it, or, but it does not actually ultimately serve the American people. And they don't really understand the implications of that because they don't deal with it themselves, right? Like it doesn't touch them in the way that it touches somebody like you, right? In the way that it touches somebody like most of us, actually. And so I think that kind of experience is really critical to inform good policy making. I really hope to see you running for something someday soon. But also I understand that you've like just come out and you're just now kind of practicing independently. And it's really important also, I think, for you to have that experience as well, to really understand the full range of issues I think that we face as physicians trying to take the best care of the most vulnerable patients. It does take, a few years of experience, I think, to fully understand that. But it's great to meet people like yourself who really, I think, have the most relevant experience to bring to public service. Unfortunately, I feel like the people who end up running at the end of the day are not the people who are going to serve.
Right.
So yeah, it's really, I feel very fortunate to have met you. I hope that everybody who's joined us today has learned something. Please follow Cleavon on Twitter. He's getting 1,000 new followers every day. And I think that his voice is one that really we all should be elevating as physicians, as other people who are non-physicians who are, scientifically minded, and who believe in really addressing the issues that impact, especially upon the people who are most vulnerable. So yeah, you're a great voice to have out there. Thank you so much for everything that you've done so far and the risk that you've put yourself in, really, by being visible and by being loud,
I mean, you have to, right? There was no other way this was going to end up with a pandemic, and me having served in Iraq having had that moral obligation to Americans. Like, I can't sit and see people die from a deadly virus and not say anything. That's just not going to ever happen with me. I just can't do it.
Yeah. Yeah. And that's exactly what we need. I mean, we need people who are, really driven, I think, fundamentally, but by, a moral compass, really.
Exactly. What compass that, y'all? I'll tell you something that how border health, do you have time real quick?
Yeah. Go ahead.
So quickly, how does like immigration a policy affect an outcome in healthcare? I had a young woman who was 45 years old, who was undocumented, who presented to the hospital in New York, and she was unable to breathe, and then I had to intubate her. A young woman, very young. So I check up on her the next day, weeks after, and she's still intubated. And then she gets extubated about 2 weeks later. She wakes up and she finds out that her two brothers and her cousin died from COVID. So the problem is she and her family presented very late because they were scared of being locked up or deported to the hospital. So she ended up losing two brothers and a cousin, and she also had like a severe lung damage as a result. And then she ended up leaving AMA from the hospital. So policy is important in health, and that story always sticks with me every day.
Yeah, no, that's super powerful, and I mean, really hits home for me because I've spent so much time doing immigration advocacy. And I completely agree with you. There are so many things that we have done to create fear among our immigrant families that they don't engage with the systems that have been set up to serve the people who are most vulnerable. So even what we do have, they don't engage because of the fear. Especially in the last 4 years. But I think even prior to that, I think going into this new administration, we do have a lot of hope that things will change. But historically, over many decades, we've had policies that have really been impediments to people in our immigrant communities, like being more visible, right? Yeah. Anyway, thank you very much, Cleavon, for your time. I know that you have to go get your vaccine now. Which we're all yeah.
I know, right? Let's go.
Amazing. Yeah.
Thank you so
much. Yeah. Thank you again. We'll talk to you soon. Bye-bye.
Take care.